if you talk about appearance all the time and body all the time, then your child will internalize like, oh, this is important. I need to pay attention. Even if it's not talking to them about them, even if it's talking about yourself. If you stand in front of the mirror or like you're always like, oh, like I'm fat, I need to lose weight, like whatever, I don't like my body, then that actually models for them this like dissatisfaction. Both you don't like your body and can't accept it, and also that this is very bad. Like this is something that they should pay attention to. And so a lot of it has to do with nurturing all these different parts of their personality and their individual and their strengths so that they feel like they have value altogether as a person, kind of regardless of how they look. You can also help to model healthy eating behaviors. So not be very restrictive, not be like, oh, I can't eat that, like that cookie will be very bad. But model like healthy and flexible eating. So having that habit and family meal times can be a really helpful thing also. So.
Okay. So next question is more of a follow-up. So what are the signs when you see teenagers starting to, when you see or have, or what are the signs that our teenagers are having an eating disorder?
Yeah, so I talked a little bit about the signs that you might see in the presentation, but you might also see more like a general withdrawal. Like you might not be able to know exactly what's going on, but sometimes what you might notice is like a little bit of a withdrawal. So maybe they used to always have dinner with you, but they're like, oh no, I'm not hungry, or I already ate. Um, or they start hiding food from you. So actually, to do with the previous question, I just like thought of, so I think a lot of parents, my parents included, like I would snack a lot as a teenager, right? Like, which is fairly normal. And, but like sometimes my mom would be like, oh, you're eating again. So commenting on like, like why are you doing this? So anyways, for this one, you might notice more of like a withdrawal and a little bit more of a barrier between you. They might seem less happy or they might be very anxious. But a lot of the times, it can be kids who are very high achieving. It can be kids who are very perfectionistic, have always like done really well. Um, because perfectionism is also actually associated with it. And so starting to notice that, starting to notice like I'm not hungry for breakfast or all the snacks in the house disappear, maybe even at a higher rate than, teenagers in the house. And people, if they are really dissatisfied, like if you see them like checking their body or they're like always like trying to change their appearance or they want, a lot of different clothes, they want to like look a different way. Um, like all of these things are signs. Sometimes, you might actually, pay attention. Like people do start to purge often in high school or as teenagers. So sometimes if you're paying attention and it's gone to that point, people can actually be very quiet about it and secretive about it, but you might notice them going to the bathroom after meals, like immediately after meals, because sometimes people purge like that. Um, but yeah, unfortunately, um, I feel like actually a lot of the times people's friends are the first people to notice because they spend more time with them and they can kind of see, the effect on them. So.
Okay. Um, in the same vein, do you have any recommendations or do you recommend planning meals with the teens, or do you like should we make sure that uh, we they have breakfast every morning, or supervise their breakfast or anything else? Is that warranted, or any recommendations just around that? Because a lot of times kids are always on the run, they're always busy.
Yeah. So I think it's like it depends. So first of all, it's not going to be the end of the world if someone doesn't eat breakfast one day. But I think making it a practice to plan meals together, not to enforce, not like you sit here and you eat that, I'm going to stare at you, but more like here's what goes into a nutritious meal, or we always have breakfast because that's what helps you get going and have energy to get through the day. it's more like this modeling of flexibility and like a healthy eating and teaching them the skills for it too. So maybe you cook together, or maybe they start being responsible for like dinner once a week or something. But um, it's like not, you don't want to do it in a very strict way where you're like enforcing their behavior in terms of clamping down. You kind of want to model and give them the skills to have this more flexible and kind of overall um, more like stable and nutritious eating habits.
Okay.
Mhm.
So I we do have
I mean,
some.
sorry, and then also, but one exception is like the actual treatment for if you have a child with anorexia, like when they have an actual eating disorder, when they have anorexia, one of the things they do is called family-based therapy, where essentially the parents take over all the child's eating decisions and force them to eat food. So, what my answer was for like, if you have kids and they're not actively in an eating disorder, by the time it's like really bad anorexia, the first order of priority is forcing them to eat, essentially, which feels really bad and hard, but is sort of how that approaches. And yeah, so
And I think the vein of the questions are really around spotting, identifying
yeah,
initially versus a treatment of already defined symptoms and everything else, and then a diagnosis, and then continue a treatment. We're
right.
looking more around, what can we do as parents to just kind of
Yeah.
spot and maybe encourage better habits to
So
avoid these types of issues.
I think being aware also is that when kids are entering puberty, there's often like, there's like a big change to your body, like your body shape changes. People may gain a lot of weight really fast. Your body turns into something you're not used to. And sometimes that time can actually be very difficult and trigger more of this like discomfort in your body. And so, as parents too, like knowing that that's part of the picture can be really helpful. Like that's something to look out for is like if a kid is like really struggling with like your body changes.
Yeah. Okay, so let me continue. We have a couple questions from the audience. So the first one is, do you recommend Wegovy? I don't know, I never heard of it, for weight reduction?
Yeah, so this is talking about the kind of medication that you prob maybe has been very popular in the past couple years. So Wegovy is one, and the other major one is called Ozempic. They're originally diabetes medication, but recently, in more recent years, people have started taking them just for weight reduction. So I can't make a blanket recommendation because I am not a medical doctor, and that's going to depend on your specific situation. But here are some of the considerations. So if it's recommended by a physician, for example, if you're like pre-diabetic or you have diabetes and are seeing some of these actual like medical impacts of weight, and those are difficult to get under control, like then yeah, they might prescribe it for that reason. It gets more complicated if someone has a history of an eating disorder because I do have people who have had eating disorders and they really want to take the Wegovy or they really want the Ozempic because they really want to lose that weight, but that can actually trigger more of this focus on the weight. It like I would worry that it would sometimes trigger more of these eating be like disorder behaviors. But some people also say that it actually helps their craving, kind of the food noise, what's called food noise. So like the amount of space in your mind that's like thinking about food. Sometimes some people say it quiets that down, so it's helpful. So anyways, this is going to answer the answer is like it's going to vary by individuals and your specific situation.
Okay. Um, Next question we have. Could you talk about how to treat autism-related eating problems, i.e., eating only limited type of food? If it's untreated, could this become worse? What's your advice for these parents and for food preparation? Some like picky eaters and or other elements.
Yeah. And I do want to say I'm not an autism expert. So just putting that out there, but I can make some sort of general statements about that. So, the first thing that's actually really important is having it be recognized as like why someone is a picky eater. Because a lot of the times the picky eaters, like the people with autism who only eat some foods, they get lumped in with the people with anorexia, but the reason is very different. And also those settings, those treatment settings can actually be a very bad fit for people with autism. And so you really want to find someone or a treatment that specifically is geared towards like the sensory type of challenges or like sensitivities that a individual person has. And every person with autism is different too. So it's very important to know for them individually, like what is it? Like, and to help them to start to do practice around like eating different kinds of foods, but to address it because for them it often is like not to do with the body part. It's like kind of, this textural and sensation place. It can get very serious, so you should absolutely, as soon as you notice something is going on, go find a specialist, get some help to support that because people just tend to get narrower and narrower and narrower over time. And of course, that leads to malnutrition and a lot of difficulties and impairment in life.
Okay. Okay. Um, are there any other questions from the audience for Dr. Lin? You can type it.
Yes, can I ask a question?
Yes, hi. Hi there.
Yes, hi. Yes, um, as adults, disorder therapist, I know you have a lot of experience and also for the research and also a lot of, the practice case. How you management about like adults, anorexia nervosa patient increase, their motivation for the recovery or motivation to get more food and weight, because that kind of patient is very fear to get weight, and also eating disorder normally is their coping skill for emotional pain.
Mhm.
So as the expert, how you handle this kind of things to let them get more motivation for recovery.
Yeah. So that is such a tricky question because there's no magic answer. Like there's no one way that like definitely always works. What we do know is that the first thing you do is by any means possible, get more nutrition in them because that will get them to a place where they can think. Like you can't, it's really hard to also like when you're malnourished, it actually places you in this very low depressive state. And um like when I've met people in that state, sometimes it's almost like talking to a wall. Like they're so shut down and they're so just still and depressed and like nothing that you really need to get more food in them before you can think about doing anything, because they don't have the capability at that point in time. Then as the food, like as there's more nutrition, then it's also really important to understand for each person specifically what is going on because people do this for different reasons. Sometimes people become anorexic because they had, for example, like some sort of trauma or like physical or sexual assault. Sometimes people do it because they dislike their body so much that they can't stand to be in their body. Like each person is going to be a little bit different. And so understanding where they are rather than trying to force something on them, first, like just being like, wait, where is this? What is going on here? Um, is going to be really important. And whenever we're talking about building motivation, it's a little bit similar to motivation to stop using substances. So, for example, if like someone has a drinking problem, you don't go in and say, why aren't you motivated? You should be this way. You should blah, 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 because that doesn't work. Like they need to start to figure it out for themselves and to weigh the pros and cons of, okay, changing will be really hard, but here are the ways this is really not working for me. Here are the ways it's keeping me stuck. It's keeping me from living a life that feels meaningful. So even though feels really scary, maybe at some point I have nothing left to lose, or I'm willing to be uncomfortable, to be really scared and uncomfortable to try it out, to make some of these steps to see if I feel better. So it's going to be bit by bit. You probably can't, you can't ask for like, I need you to commit to like, being totally weight restored in like this amount of time. You kind of have to go step by step. And so it always feels really bad and difficult to say that because a lot of it is actually knowing where the limits of your power are and then just creating the circumstances where you can nurture and kind of grow these little bits of motivation that people might have.
Okay.
Thank you.
Mhm.
Any other
Hi,
questions?
Stacy. I have a question.
Mhm.
Can you talk about a little bit more about night eating? Because I have some insomnia issues,
Mhm.
and sometimes I'll wake up in the middle of the night. And typically, in the past for umpteen years, I would just go to the kitchen and eat something. And then after that, I brush my teeth and go back to bed, and then that seems always help. But I didn't realize, is that night eating disorder?
Not necessarily. So sometimes if you're doing it because, this is, I want to, or this is my habit, I should also say I'm not a night eating expert, but my understanding is that it's more for when you're like, I don't even know why this happens or how this happens or like what is going on. And generally, so sometimes there's actually like a sleep issue. For example, if you have a sleep disorder, some sort of sleep disorder where your sleep is impaired, or sometimes if someone's taking sleep medications like Ambien, that can kind of alter your consciousness state and like the way you sleep. So sometimes people will do things that um, they're not like aware of or consciously making the decision to do. But with night eating too, I think, trying to get to the bottom of it in terms of like figuring out triggers or like just watching, like taking data on like, when is this happening? Why is this happening? Am I more likely to be extra tired? Maybe I'm really emotionally exhausted and physically exhausted, or maybe I've been on a week of like sleeping poorly. So starting to understand for each individual person, also, I think I believe that that would be the approach in figuring out. But in and of itself, eating in like at night is not like, a disorder. Like I think it's the degree to which it's impairing your functioning. Mhm.
I have a question.
Yeah.
You alluded to, I'm trying to understand the percentage. Are you seeing more cases where men are having eating disorders? And I mean, typically, the stereotype is it's a young girl who has eating disorder. They're trying to lose weight, and be as pretty as possible because the stereotype is very, very thin and such. Do you see more men, or do you see is it culturally in the US, or is it more worldwide, or is it just more of an evolution that people are more cognizant, or perception is just men hide it better or they don't?
Yeah. I'm super glad you asked. There's actually a lot of stuff behind like who gets eating disorders and like our relationship to that, which is like really interesting. So I'm gonna like try to so first of all, um, research wise, the evidence is pointing to it's both that they were under-recognized, so more are being recognized, and the rates are going up. And some of it is attributed to, for example, if like people are on social media a lot, the getting like really, really jacked, people who go to the gym and like kind of you see these pictures of men who are expected to have this like muscle definition that's really like not realistic. Sometimes they're using steroids, but like people see this and teens see this or younger, like, or boys see this and they're like, oh, this is actually what I'm supposed to be like. This is what's attractive. This is like how I'm supposed to look. And so sometimes dissatisfaction with your body can come that way. But actually, for binge eating, the gender ratios are a little bit more equal because binge eating is tied more to managing painful emotions and feeling bad about yourself. It's like less directly to do with like the body. It's more like I have a lot of stressors. I have no outlet. I don't know how to deal with this. Um, Suddenly I'm finding myself eating large quantities of food. So the ratio of males to females who have binge eating is actually a little bit closer, whereas in anorexia and bulimia, it's still pretty lopsided, but getting less lopsided in terms of that. It's also interesting because there is like a cultural component, it seems more to bulimia, but anorexia, we've actually observed kind of forms of it throughout history, which is really strange. But there are ways in which some people don't have the wiring, like the physical and neurological wiring to actually get into the cycle of anorexia and stay there. So many people, most people's bodies have this survival instinct essentially where you're not going to get into a place where you're starving yourself so much that you're not eating. Um, so people then tend to turn into, they have bulimia because they're like, I'm trying to cut down, but like I can't. And now I like see food and I binge eat and I'm like back and forth and back and forth. But like there's actually research around the genetic and like neurological portions of anorexia that some people are more actually just likely to get it. They're wired in a different way. And for that, I guess this isn't specifically about men or women, um, but there are also like a lot of those aspects that are underrepresented. The gay male community, actually, if you're a gay male, there are often the thought is that like in those communities, the standards for attractiveness are also very high and very strict. And so sometimes that can be a higher pressure environment for men in terms of their physical appearance as well. So yeah.
Let's see how we're doing on time. We're coming in 4 o'clock. Do any more questions from the audience? We do have time. Or
It's also great if I've answered everyone's questions.
thanks. You may have answered that. Or Dr. Lin, do you have anything you wanted to maybe dig down any deeper for the audience? Is there any subject or any topic that you would want to do a drill down?
Yeah, kind of. Like I'm thinking about this audience in particular and the ways that parent-child relationships, particularly in our culture, can be stressors specifically for children. So I'm thinking about some of the stereotypes around Asian or Chinese parenting and the pressures that the kids feel. It's associated not just with eating disorders, but kind of mood stuff and like difficulties overall. Um, I do think those cultural aspects are really interesting and like the generational clashes between in communication. So I'm thinking of how I kind of said in one of my slides, like one of the most common conflicts ends up being this dynamic between a parent and child where like the child is actually really hurt by something like, you got fat or like, why do you eat so much? Or like, your like hair is messy or like clean yourself up. Like the children can really take that to heart when parents don't think it's very serious and are used to kind of very casually, not without thinking too much, like saying things like that. And they don't necessarily mean it as criticism, but if there's enough of it, like it is experienced as criticism. But sometimes you get into this dynamic where the parent is like, why are you so sensitive? And the child is like, why are you so hurtful? Stop saying that. Like, you're really mean. It's really hurtful. I want you to stop. And then the parent is like, I can, this is for your own good. I can say whatever I want, like you need to just like be tougher. And that's a really not helpful dynamic. So people get really dug in. And it's really important to understand, the differences there where, what is an expression, a regular expression of care, perhaps, or something that's not that big a deal can be a big deal to somebody who is raised in this culture, in American culture, where we don't think it's very nice or polite to comment on someone's body. Like generally you wouldn't, right? Like, and generally you wouldn't like immediately comment on someone's food either. And so not invalidating that and instead trying to soften and be like, oh, okay, like what does that hit on for you? I understand, I will make an effort. That's one of the communication things that tends to like repeat itself a lot, I think. I guess that's what I thought of. There's the other aspect of like academic pressure and general pressure to be a good child, to like filial piety, also actually contributing a lot to stress and the feeling that of children that they need to be perfect. So that's also an interesting aspect. Yeah, that was just kind of thoughts bouncing around that.
Okay. Audience, anything? Otherwise, this may be a very short seminar.
Yep.
No, I think it's been a really good information. So and thank you, Dr. Lin.
I have one more question. What
Sure.
if a child is on his or her own, tends to be perfectionistic and get frustrated when things are not perfect?
Yeah.
What
That,
are some things you can say to help out with that?
so that's a challenging one because usually perfectionism is in there very deeply, and by the time someone has internalized that, um, generally they are very, very invested in this perfectionism and will have a lot of anxiety or discomfort or feel upset with themselves or highly critical of themselves if they're not. Um, So at that point, I think, getting them into therapy if they're willing, it doesn't even have to be like, we need to get rid of your perfectionism, but more like, hey, like your life seems pretty hard, because you're feeling a lot of stress walking this like tightrope around staying perfect. But like there's more and more responsibilities and like how you're managing that. So opening that up. Um, but again, as a lot of this is it's very hard to directly change. Like you sort of have to like model and make gentle shifts from these different directions because directly telling someone you're too perfectionistic and hard on yourself, like that doesn't tend to work right away. And so you can model like, oh, like I know like it was really disappointing that you didn't get such a great grade or like you didn't get that job. I know you tried really hard and hopefully it'll happen next time. So you can actually say out loud kind of the more compassionate and the more realistic versions of it because what you're trying to do is you're trying to slightly, over time decrease that subconscious fear that they have of if I'm not perfect, then people won't want me or love me and I won't be okay. I won't be worthy. So you're trying to diffuse that. You're trying to recognize effort versus results. I mean, results are still important, but like you're trying to acknowledge that effort also counts and that sometimes in life, like this is just going to happen but that say like you can be resilient to this like I know you're very hardworking and you're really talented and I hope it works out next time so it's kind of more like that it's like how you talk about it.
Okay, thanks.
Any other questions? Okay. Thank you very much, Dr. Lin. Thank you for this presentation. Thank you for coming. Uh, And for Wiz Chinese and the Chinese Parent Organization, thank you very much for attending. I think we are done.